Hi, my name is Shelby and today I'll be inserting a Foley catheter. To begin, I'm going to go ahead and look at my provider's orders, and I see that Mrs. Charlene Knight has been ordered a Foley catheter insertion because she's had urinary retention and she's been unable to void. So to begin, I'm going to go in and talk to my patient. Knock, knock, knock. Hi, my name is Shelby and I'll be your nurse today. Can you please verify your name and date of birth? Okay, I see Mrs. Charlene Knight, 8839, and I also know that Mrs. Knight is allergic to penicillin, latex, and betadine, so I'm going to make sure that that is not involved in the procedure today. But Mrs. Knight, I hear that you've had some symptoms of urinary retention and you have not been able to urinate, so the doctor has ordered a Foley catheter insertion for you, so I'm going to go ahead and do that today. But to begin, I'm going to go ahead and assess the area. So I'm going to perform hand hygiene and put on some gloves. All right, Mrs. Knight, I'm going to go ahead and take a look. And I just want to go ahead and identify the urinary meatus. I'm going to make sure it looks clean, and I do know that the nurse aide provided perineal care this morning, so it looks good. I'll look for any abnormal lesions or discharge, which I don't see, and I'm also going to palpate the bladder to note any distension or tenderness, and I do note distension, which is to be expected with urinary retention. But Mrs. Knight, I don't see anything that would prevent me from inserting the Foley today, so I'm going to go ahead and get all of the things together. All right, hand hygiene. Now I'm going to come over and I have my Foley catheter here, and I'm going to go ahead and check it with my provider's orders. I want to make sure that the order matches up with what I have here, which is a 14 French. And I also want to make sure that there's nothing in the catheter that Mrs. Knight is allergic to, which I don't see anything. So we're good with the provider's orders. I want to make sure I have a clean, dry surface that I'm working with. So that looks good. I'm also going to verify that my catheter is not expired and that it is dry and intact, which this one's not because I have used it for practice, but in a real life situation, I would make sure that it wasn't opened or anything like that. So to begin, I'm going to go ahead and take this out and place it at the foot of Mrs. Knight's bed for a trash can. And I'm also going to go ahead and, Mrs. Knight, I'm going to put you in the correct position right about now. Okay. And I'm also going to make sure that Mrs. Knight is in the correct position and that she is at waist level. In dorsal recumbent position. Okay, and I'm also going to make sure my surface here is at waist level as well. So now that I'm getting ready to open this, I'm going to perform hand hygiene one more time. And I'm going to begin opening my package. My first flap I'm going to pull away from me, and I'm only going to be touching within the 1-inch borders. Then I'm going to do the side flap. Other side flap, and the last one. I'm going to go ahead and position this so that it's not over too much. And then I'm going to go ahead and grab my blue drape first. I'm going to be grabbing within the 1-inch borders on the shiny side. And I'm going to go ahead and step back, open it up. I'm going to go ahead and lay it over my patient. All right. Now I'm going to come back over here and I'm going to open my gloves and place them over here. And I also want to make sure that I always have both of my sites, or both my sterile fields in sight. So I'm not going to be turning my back. And now I'll put on my sterile gloves. Again, staying within the 1-inch borders that I've given right here. Okay, to begin, I'm going to go ahead and take my non-dominant hand and grab my right cuff of this glove, pick it up and step back so I'm not reaching over. And I'm going to go ahead and supinate my hand inside the glove. Again, only touching the cuff of it. I'm going to go ahead and take my forefingers of my right and put it under here. Lift it up and step back, so again, I'm not reaching over. I'm going to go ahead and stick my hand in here. And now that my hands are sterile, I did mess this up, so I'm going to go ahead and fix that. Okay, and I'm going to put my hands together to make sure they're secure. I'm going to come back over here, and I can throw this away. Okay, again, I'm also going to make sure that I always have my hands above my waist level so I'm not contaminating anything. I'm now going to grab this white drape and place it over my patient so that I have a larger sterile field. Okay, and now I'm going to come back over here and get all my supplies ready. So to begin, I'm going to go ahead and pick up my hydrogen peroxide and place it over my cotton swabs. Throw that away. Then I'm going to take the lube, put that in the corner of my box, throw that away. Then I'm going to go ahead and I see that I have 10 milliliters of sterile water, and I'm going to verify that my balloon is the correct size for me to insert that. So I do see that I have 5 to 10 milliliters. So I'm going to throw this away and attach this. All right, now I'm going to go ahead and grab my tip of my catheter and take the sheath off, making sure to hold it with 2 hands so that it's stable. And I'm going to go ahead and lube the edge of this catheter for easier insertion. And I'm going to go ahead and place it back in here. And place this on here. And now I'm ready to move over to my other sterile field. So this one will no longer be in use. Okay, and I can now pick this out of the way because I'm done with that, and this is my primary focus right now. So to begin, I'm going to go ahead and take my non-dominant hand and place it on the labia, and I'm purposely contaminating it. And I'll keep my hand here during the entire sterile procedure, and then I can remove it after that. So to begin, I'm going to go ahead and clean from clitoris to anus, and I'm going to grab with my forceps, and I'll clean the outer labia first, clitoris to anus, reach around my field, throw it away. Then I'm going to clean the inner, around my field, middle. Okay, then I'll do the other side, outer labia, inner, and middle. All right, I'm also done with my forceps, so I'm going to go ahead and throw those away. And I'm now done with my tray, so I can get rid of that as well. Now I'm going to go ahead and grab my catheter 2 to 4 inches back, and I'm going to begin insertion. So I'm going to go ahead and make sure to tell Mrs. Knight, Mrs. Knight, I'm about to insert the catheter, so if you could please bear down with me, and you'll probably feel a little bit of pressure. Okay, so I'm going to go ahead and visualize the meatus, again 2 to 4 inches back, and I'm going to begin insertion, and I want to make sure that I'm not contaminating the tip by touching it with my fingers or by touching the labia. All right. And once I see urine, I'm going to go ahead and insert 1 more inch. Okay? Making sure I don't feel any resistance. Now that it's inserted, I'm going to go ahead and hold it, stabilize it with that finger, and I'm going to go ahead and insert my 10 milliliters. All right, and once I've done that, I'm going to go ahead, lift this up here, and unhook it. I'm done with that now. I'm also going to give it a little tug, make sure it's in there good. And now I'm done with my sterile procedure, so again, I can let go of my labia. And I'm going to go ahead and attach it to the side of her leg right here. And I'm going to place the back of it and attach it to the bed and not to the rail, so I make sure that it's stable. And so once I'm done with that, I'm going to make sure Mrs. Knight did okay with the procedure. I'm also going to inform her that I'll be back every shift to perform perineal care. And I'm going to document accordingly the input, the output, how Mrs. Knight tolerated the procedure, the color, the consistency, document accordingly. And then I'm going to go ahead, take my gloves off, and perform hand hygiene.